going on currently with testing? We've been promised 100,000 tests daily by the end of the month. You have 8 days to get that in place. Currently, we are we're not even near half of that. He was talking about one particular care manager who said in order to get his carers tested, they needed to do a 5-hour round trip. How are we in a situation where care workers who need to be tested for COVID are making round trips, or in that case, I'm sure not making those trips?
So you're right that we've now started testing care workers. So that was an important step, going from testing patients, NHS workers, to testing care workers. And CQC has contacted every single registered care provider to offer them access to tests. And over 18,000 care workers have been referred to tests. And we're also hand in hand increasing the access to tests, because the point that you've just made is it can be difficult to get to the testing site. At the moment, there are 27 testing sites. We're increasing that up to 50. But we also know that not every...
What about mobile testing sites? What about
Indeed.
Sending tests to care homes, to GPs, so that they can do the tests? Why are we making it so hard for carers and health workers to get themselves tested, to the point where we've heard the Health Secretary says, well, we're increasing the capacity, but people simply aren't taking those tests up. Well, if you're expected to make a 5-hour round trip, how on earth can you expect people to?
No, you're absolutely right. So we're taking steps to make it easier to access tests. And in fact, following the 2 routes that you, I think, just mentioned there. So one is having mobile or satellite testing that gets it closer to people. And we trialled that earlier this week, and we're going to do more of that because it worked well. And the other is home testing, so getting testing kits delivered directly to people's homes so you don't have to leave home in order to do the test. Because as you say, it's not enough just to have the capacity. We've also got to make sure that people can actually access those tests, even if they don't have a car to get to
How
a
many
test
tests
centre.
did you do yesterday?
So yesterday, over 18,000 people were tested.
18,000. So you've got 8 days to get from 18,000 to 100,000 a day. You're not going to do it, are you? In fact, you're not going to be anywhere near it.
So that's against a capacity of 40,000
I don't care about capacity. The Health Secretary assured us 100,000 people a day would be tested by the end of April. I don't care what the capacity is. That's your job, is to make sure the tests get done. 18,000 yesterday is nowhere near 100,000. What happens when we get to the end of April and you've become woefully short of that target? Where's the accountability?
So, well, both capacity and the number of people actually taking up tests does matter, because if we don't have the capacity, we definitely can't hit the 100,000. So we both need to have the capacity to do the test and have people going forward.
He promised 100,000 tests would be done a day. He didn't mention capacity. It's 100,000 tests would be done a day. Was he lying?
Yes, but the capacity mattered because before we couldn't do the test, more tests.
Yeah,
because
I'm more interested in the number of... I want to know if the Health Secretary is going to meet his own target that he used as a distractionary tool to change the agenda from criticism of the government to a positive. We're going to be testing 100,000 people a day by the end of April. It is now April the 22nd, and we're actually testing less people yesterday than we tested 12 days ago, which I would argue is a spectacular failure. What would you call it?
So we know that testing is really important, and so we have been working hard to ramp up the testing capacity in the country.
Yeah, I don't want to hear about your ramping up, though, Care Minister. With respect, you're not ramping it up. I've just told you you've done 18,000 yesterday, and that is less than you did 12 days ago. So when you keep saying you're ramping things up, actually, you're not. You're going backwards. Do you see?
So we have trebled the amount of tests that we can do since the beginning.
You're not doing them.
People can't get to them.
You're doing 18,000 a day, which is less than you were doing 12 days ago.
Well, if you'll let me finish speaking, I
You're
will
answering
explain
different
what we're
questions.
doing to...
You keep talking about capacity. I'm asking you how many you've done.
I'm giving you the context and explaining both sides of the equation. One, I won't say it again because you will probably interrupt me, is access, is the capacity, and the other is the access to tests, and increasing the number of people who are eligible to come forward and get that testing. So we started off with patients in hospital and then NHS workers. We extended it to those working in social care, and that's those in care homes and those providing domiciliary care. I'm looking at whether we can extend testing to personal assistants who are employed by people who pay through direct payments. And we're also extending it to other key workers. So, for instance,
you should have been doing all this weeks ago, with respect, Care Minister. And the fact you're still doing less yesterday than 12 days ago shows me this 100,000 figure was just plucked out of the air and is complete nonsense. Let's turn to the number of people who've died from COVID-19 in this country. How many is it?
So we've now seen just over 17,000 deaths in hospital, and the ONS told us yesterday that they have a figure of 1,043 who've died in care homes.
So you think it's about what, 18,500, 19,000?
So I think we probably have seen more people than that die in care homes, and I hope that.
How many? You're the Care Minister. How many more have died than the government figures?
So next week, I hope that we will be able to publish figures specifically.
I don't want to wait a week. I want you to tell me as chairman. We had this conversation last week, and you didn't know then. You've had a week, so you keep saying next week. Now, I'd rather concentrate on the now. How many more people do you believe, as Care Minister, have died in care homes than the government's official figures?
So the situation with the data that we have at the moment for deaths of people in care homes is it includes some who have died in hospitals. So it's an inaccurate figure and would be misleading because of that double counting. So what we're doing is we've started a change in the way that we collect the data, so that we will be able next week to publish a specific figure for people who specifically died in care homes.
The Financial Times has a specific figure today. The Financial Times says it's over 41,000.
That's not a figure that I recognise, and I think that probably suggests one of the problems with using data that isn't necessarily accurate and hasn't been validated. And I think it's really important.
So you're saying the Financial Times, who've done a very detailed analysis of this, which I suggest you read, that the Financial Times has made this up?
That's not a figure that I recognise in the slightest.
No, I know you don't, because you don't know how many have died. It's hard to recognise it when you've no idea what the number is, isn't it?
So what I said is we will come next week and we will publish the figures.
You said this last week, Care Minister. I mean, you come back on this programme after what many thought was a train wreck interview last week because you didn't know these numbers, and you still don't know, and you're still saying, I'll come back next week. At what point do you come back and actually have an answer? The reality is, if you study the FT piece, which you should, you're the Care Minister, you should have been aware of this and read it all, you would see that there's a very good reason to believe that it's over 41,000 people, including thousands and thousands in care homes. That's the reality. And that is your purview. That is your job, is to know this stuff. And I find it, frankly, I've said this to you before, I find it incredibly insulting that the Care Minister has no idea how many people are dying in our care homes. These are elderly, vulnerable people dying of COVID-19, and you are not taking their deaths seriously enough. People who die in hospitals are getting treated with more respect than people that die in care homes.
So that's an incredibly unreasonable accusation. I take every single death extremely seriously. I would wish that nobody would die, but the fact is that this is a horrid virus, and we know that those who are in care homes are amongst the most vulnerable because of their age, because they have underlying health conditions, and if they catch coronavirus, they're at greatest risk. And I've been quite straight with you and others I've spoken to that we know that people are dying in care homes, and we know that more people than usual are dying in care homes.